Hi, this is Dr. Mary Kathleen Figueroa coming to you from the Thyroid Channel. If this is your first time, please be aware this is for educational and entertainment purposes. If you have specific medical complaints, please discuss them with a local endocrinologist. Today we'll be talking about the late symptoms of hyperthyroidism due to Graves' disease or whatever other condition. One of the saddest parts of hyperthyroidism is that after treatment, a patient has complaints no more of sleeplessness, they're better in their nervousness, their tremor goes away, they are able to think well and do their jobs. Everything's wonderful, except they've gained 30 pounds. This often happens to my patients, and it's really rather sad. It's one of the sadder things that happens when you treat someone for a condition such as hyperthyroidism. Hyperthyroidism on the outside can actually be mortal, can kill you if it's too severe. So it's important to treat to preserve your bones and preserve your muscles and preserve your brain and all those other important organs in your heart. But hyperthyroidism, once treated, leaves you metabolically at a worse place than before you had hyperthyroidism. Both high TSH and high thyroxine in the blood, so both hypo and hyperthyroidism are associated with excess risk for diabetes. So because your metabolism is slowed and because your liver can become fatty and because you can then have more of a problem metabolizing sugars and starches, it is important after you've had hyperthyroidism to consider those changes that have occurred and to change diet and exercise in a way that will help you to regain your body in the shape that it was before the hyperthyroidism. So I'm talking about 30 pounds of weight gain. All of it is usually fat. So a patient has lost muscle mass because one of the wasting aspects of Graves is that you actually lose a lot of muscle mass, and you lose cardiac muscle. So you have a lower cardiac ejection fracture at times. You can lower your bone mass. So lots of tissues are actually made smaller and made worse by hyperthyroidism. So you've had the hyperthyroidism treated, and now it's a few months later and you're well controlled. What should you do? Well, there are three main things I tell my patients to do, and I'd like to share those with you. The first thing that I tell them to do is to establish weight training. Often when you have hyperthyroidism, you are too in pain, you're too tired, you're too overwhelmed, and your heart rate is too fast for you to exercise. So it's not recommended in the first few weeks and months to do any physical exertion. However, later on I tell patients to really focus on their large muscle groups in their legs and in their core to regain muscle strength. So that's number one, is to do some weight training. Second, I always let them know that it's really important to develop a more aerobic strength and more stamina. So once they've got muscles going, to use them in aerobic activities. So separate from their weight training, doing aerobic activity will help to improve their fitness. And the third thing that I tell them to do is that because they're metabolically at a lower rate than they were before they had hyperthyroidism, is to lower the caloric intake. I say this to people even before I start them on thyroid medication, anti-thyroid medication when they're hyperthyroid, because I'm worried about their gaining weight. And so I let them know that they really have to cut their calories, because the calories they've been eating before have been overused by their hypermetabolic state. And now that they are no longer hyperthyroid, it's like going from 60 miles an hour to 0, their metabolism gets very slow. So I really recommend that they lower caloric intake and specifically lower starches and carbohydrates, because I know they are at higher risk for diabetes than before the episode of hyperthyroidism. Add to that often the first bout of Graves can be in midlife, when people are about to go through menopause and when people are already losing per year maybe 1% of muscle mass per year after age 40. So keep those in mind, those three things: weight training, aerobic activity, and cuts in calorie and specifically in starches and sugars, with a goal of lowering risk of diabetes, of increasing your muscle capacity, and also increasing your cardiac capacity with aerobic activity. Thanks for listening to this video, watching this video. If you liked it, please give it a thumbs up, and if you'd like to subscribe, please subscribe below, and new videos every Friday. Thank you.